Countries around the world are making contingency plans for a full-blown pandemic caused by coronavirus. As stock markets fall, cases are spreading further and further from the original outbreak in China. Sports events are at a standstill in many areas of Asia. One case has now been reported in Brazil, the first in South America. And in the last few hours, Greece has joined the grim list of 39 countries with patients suffering from COVID-19. Well, several other European nations, including Austria, Croatia and Switzerland, have also announced cases. All appear to be linked to this growing outbreak we're seeing in northern Italy, around the city of Milan. So let's take you straight there. We can go live to our correspondent Bethany Bell, who is in Milan for us. Just bring us up to date with the situation where you are, Bethany.
Well, within the last hour, the authorities have said that the number of cases of coronavirus here in Italy has risen to 374, and there are now 12 confirmed deaths because of the virus. What we understand is that those who have died were elderly or who also had underlying health conditions, and doctors say that the elderly and people like that are particularly vulnerable to this, as they would be in cases of influenza. They've also reported that 4 children have also been infected with the virus, and the first time that we understand children have been involved in that. Meanwhile, there are a number of towns just south of Milan, affecting 50,000 people that are still under lockdown, in quarantine. That's where the outbreak is believed to have begun, but the authorities are still trying to find out what happened there. The Italian Prime Minister Giuseppe Conte has suggested that the hospital in the region may not have adhered to the right protocols in handling the first cases.
Bethany, what is the atmosphere like in northern Italy? How are people responding to all of this?
It's subdued. It's uncertain. People here in Milan, of course, are going about their work, although children are not able to go to school because many of the schools in this region have been closed, the universities have been closed. Tourists don't have very much to do here at the moment because many of the museums have been shut. Even the cathedral behind me, the Duomo, one of Milan's top tourist attractions, has been closed. But people are just wondering how long this is going to last for.
Thanks for updating us from Milan. Well, let's look in more detail at how different countries are grappling with the coronavirus epidemic. The Japanese Prime Minister Shinzo Abe has called for sports fixtures and other events to be suspended over the next 2 weeks. There's worry about the Tokyo Olympics. Those officials are considering scaling down the torch relay due to concerns over the outbreak. Real concern about what is happening in Iran. The Iranian president, though, saying no city will be quarantined. Hassan Rouhani hitting back at US Secretary of State Mike Pompeo over his recent statement that Tehran may have been concealing vital details about the outbreak. In Iran, we are seeing reported 44 new cases, 4 more deaths in the past 24 hours. More on Iran coming up in a few minutes on the programme. But let's just show you as well the Canary Islands. Hugely popular destination for many Europeans, chasing the winter sun. 4 cases of the coronavirus have now been linked to a hotel, this hotel in Tenerife, where hundreds of tourists had been ordered to stay in their rooms. An Italian doctor who was a guest at the hotel tested positive for the virus on Monday. The BBC's Fiona Trott is there.
From what I understand from people inside the hotel, basically you have teams of about 2 or 3 medical staff going from room to room carrying out assessments. Look at the size of this hotel. There are about 1,000 guests and staff here. They are knocking on doors, checking their temperature and giving them face masks. And the advice so far is to stay in their room. Some people I've spoken to have not left their room for 24 hours now. They're frustrated, they're stressed and they're tired. They've just woken up, they want to have something to eat, something to drink, but of course they can't go down to the restaurant. They're being told that food will be delivered to their door, and of course we've heard from the Health Minister of Spain, haven't we, just appealing for people to be patient because this is going to be a long process. Some good news though, we have heard as well, haven't we, overnight from the President of the Canary Islands that they are hopeful that some people here, maybe 100 or so guests, may be able to leave in the coming hours, they say, because they would have arrived after the infected people had already left the hotel.
We can actually talk now to Harley Mitford, who is on holiday with his dad Pete and sister Rosie in Tenerife. Good to see you. You're looking well. How long have you been stuck on your roof for?
Just over 24 hours now. We were first told at about, I suppose, 9:30, 10 o'clock yesterday to head to our rooms.
And what exactly have you been told?
Well, very little really. Whenever we say the word coronavirus, the C word, so to speak, they sort of clam up and they just say nothing's been confirmed, this, that, and the other. Please go back to your room. They have used the word quarantine in a second note that they gave to us yesterday. But the first thing that happened was they delivered a note through all of our doors, except for ours, it seems. We didn't get one. Early on yesterday morning, saying that the hotel was in medical lockdown, and all the gates had then been locked, and there were policemen at every door, so nobody was coming in or out.
And you don't know how long this will go on for? They've given you no idea, Harley?
No, they've not really given us any idea. I think deliberately so. You know, they don't want to get people's hopes up. Understandably, they don't want to cause a panic or a riot or anything. So everybody's coming, everybody's being very calm, just standing at reception asking, and they're saying, we don't know, we'll let you know as soon as we can. There's going to be, although we do at least know that there are going to be 2 more sets of doctor's visits today to establish our temperatures again. We're supposed to be self-recording, but it's a bit chaotic as to whether they actually check up on that. But supposedly there's going to be doctors coming around later today.
You seem very relaxed. Are you, or underneath it all, are you also a little bit worried?
Well, there's obviously a simmering worry there that, you know, that we're going to be stuck here for 2 weeks and then potentially another 2 weeks in quarantine if and when we get back. You know, so we're concerned, but I mean, what can you do? There's no use in panicking, and there's been no sign of anybody actually getting ill. So it seems as though whoever had it is now out. You know, it was, I think, just the doctor and his wife. So, and now that they're gone, it seems like everybody's okay. So if it continues to be that, then we're hearing whispers that they might think about letting us go sooner than 2 weeks. But it's very difficult to say, really. It's all rumour at the moment.
And no idea as well what will happen once you do return home, Harley?
Well, precisely. You know, there's this quarantine facility in the Wirral that some people are sent to when they come back. So I don't know if we're going there. I don't know. But then again, some people coming back have just been told to self-quarantine. So it's difficult to say at the moment. We've not heard anything from any British representatives or any government, anything really. So we're just waiting to hear.
Harley, thanks for taking the time to talk to us. Good luck over the next few days.
You're very welcome. Thank you.